Hi, I'm Kaylee.
And I'm Vivian, and we're going to be your student PT today. So we're going to work on, well, I heard you're here for some back pain, is that correct?
Yes.
So we're going to work on exercises to help you with your back pain, and we're going to go through all the ways that you can regress and progress all those exercises. Does that sound good?
Yes.
So the first exercise that we're going to be doing is prone push-ups. What I'll have you do, you're going to get on the table and you're going to start on your tummy. And what you're going to be doing is just using your arms to press up, leaving your pelvis and hips on the ground or the table. And you're just going to be able to push up as much as you can, feeling that stretch in your lower back. And then you're just gonna come back down. With these, we're gonna be doing 3 sets of 15. Or to regress this exercise, instead of coming up fully on your hands, you're just gonna be able to come up on your elbows. And you're gonna still be able to feel the stretch within your lumbar. To be able to progress that prone push-up exercise, what we'll be doing is a lumbar extension in a seated position. So what you're going to be doing is grabbing a foam roller or a pillow. You're going to put it about your lumbar or your lower back. You're going to put your hands up about over your head, and you're just going to lean back into that pillow, still feeling that stretch within your lumbar. So okay, we're going to be doing that push-up exercise. So yes, you have your hands in the right position, and what you're going to be doing is pushing up through your hands, leaving your hips on the table. Awesome. And then come back down. How's those feeling? Is that okay?
Good.
And I'm just making sure, so you're feeling the stretch right in here?
Yes.
Okay, did you have any pain with that?
No.
Okay, that's good. If you did have pain with that, then we would do the elbow press ups. The next exercise that we're going to be doing is bridges with a pelvic tilt. So with this one, you're going to get into a similar position that I am in. You can stabilize on the bed with your arms, and what you're going to be doing is pushing through your feet, lifting your booty off the table, coming up into this position. So what you want to do while doing this is you're going to be squeezing your butt cheeks, lifting up at the same time. What we're also going to be adding into this, preferring on the patient, is the anterior and posterior tilt. So I will cue him to do this while he's doing it, but he'll lift or push his pelvis forward and lift up, or he'll be able to flatten his back and then push up. A way to progress this exercise is when you come up into that bridge, you will bring one leg up and then the other leg up and then come back down. Regression one, for the bridges, if they're not able to do that, all we're going to be doing is flattening out the back on the table for that posterior tilt, and then they're going to go into that anterior tilt, creating that space between their lower back and the table. And they're also, while they're doing that, they're going to be squeezing their glutes together. So posterior tilt, and then also anterior tilt. We're going to be trying the posterior tilt. So what you're going to be doing is trying to squish my hand with your back. So you're going to rotate those hips up and back. Awesome. And then you're going to hold that, and you're going to squeeze your butt cheeks together, and then you're going to lift your booty up, pushing through your heels. Okay. Awesome. How does that feel?
Good.
No pain?
No pain.
Okay. And then we're also going to be trying to see the anterior tilt. So what you're going to be doing is pushing your hips the other way. So making that arch. Okay. And keeping that core tight in your booty cheeks. You're clenching them together and pushing through your heels and pushing up again. Awesome. How does that feel?
Good.
Okay. And then if he was having pain with this, we would do the regression. So So with this exercise, we would do 3 sets of 15.
What you're going to do is a dead bug. What it is you're going to engage your core, drawing that belly button to the spine and making sure your back is flat on the table. You're going to have your hands up and your knees up towards your chest. And what you're going to do is drop one leg down and one arm down at the same time while keeping that core engaged. And then back up and then alternating to the next leg and then coming back up. And then for the progression of the exercise, staying in the same position instead of dropping the heels, you would kick your leg fully out and hold maybe 1 or 2 seconds and bring it back in. And then same with the other side. And then for a regression, you can either do a hold pushing into your knees while keeping your core contracted, or if that is too easy, you would start on the floor and do some marches. What we're going to do is the dead bugs. What I want you to do is draw your belly button to your spine and get that core engaged. Alright, flat on the table. Can I have both your arms up and your knees, bring them up to your chest, please? What you're going to do is, while keeping this core tight, I want you to bring this heel down and this arm back for me. So go ahead and do that. Perfect. And then go ahead and bring it back up. You're going to switch sides now. Great. And then bring it back up. Does that feel okay?
Yes.
Alright, so what we would do is we would do 4 sets of 8 reps. Doing is the RDL. What I'm going to have you do is have a slight bend in your knees. Your feet are going to be hip width apart, and I'm going to have you go straight down, pushing your hips back until you feel a nice stretch in those hamstrings, and then standing back up, making sure your core is engaged the whole time. And what you're going to do is just do a hip hinge, so the same thing without the weight, and you're going to do with less range of motion. So you're going to still have those light knees bent, feet flat apart, hip width apart. You're just going to push the hips back until you feel a nice stretch. Squeeze the glutes to stand back up. And then for progression, what we're going to do is add a heavier weight. Same thing here. Hip shoulder width apart. Feet shoulder width apart. Knees lightly bent. You can go full range down to the ground until you feel a nice stretch of the hamstrings, and then stand back up while keeping those cores engaged. So what you're going to do is have your feet shoulder width apart. Your knees are going to be lightly bent. You're going to draw your belly button to your spine and tighten that core. Go ahead and reach down like you're grazing those shins until you feel a nice stretch, and then stand back up. So I'm going to check one more time to see if your back is flat. Is that feeling okay?
Yes.
Where are you feeling those muscles working?
Lumbar.
Lumbar? Anything in the hamstrings?
Yes.
Okay, perfect. And he's going to do 5 sets of 8 reps. Okay, so the next exercise we're doing is a peel-off press. We're going to go ahead and bring the press to our belly button, drawing your belly button to your spine with your arms down and back. You're going to take 3 steps out, keeping that core engaged, not using the hips, and making sure that it's in front of you, and 3 steps back. We're going to do that for 3 sets of 15 on both sides. So the regression I'm going to do is just have the arms straight out, and then have someone pull the cable, making sure the core is engaged. And for the progression, it would just be still belly button to spine, arms straight out in front and back for repetitions for 3 sets of 15. Okay, so what I'm going to have you do is bring that to your belly button here, draw that belly button to your spine, and I'm going to have you keep that here. And go ahead and take 3 steps out to your left, and make sure that the rope is still in front of you, keeping that core engaged, and that rope still in front, and 3 steps back. Perfect. And then we're going to do it one more time to make sure those muscles are working. So draw those other muscles in. Go ahead and take 3 steps out towards me. Make sure those hips are low and not turning. Same thing here with the shoulders. And back. Just keeping that core engaged there. Does that feel okay? Alright. And can you do one more time?
exercise, we're gonna be doing a squat with weight. So just get into the position of about feet shoulder width apart. So you're gonna tighten your core, you're gonna throw the hips back, and you're gonna keep that back nice and straight. You're gonna grab the weight, and while you're coming up, you're gonna squeeze the glutes. So if the patient was having pain or any difficulties with that, one way to make it easier, we can just do squats without weight. So same setup, feet shoulder width apart. They're gonna throw that hip back, keeping the back straight. They're just gonna go into that squat position and again squeeze the glutes while they're coming back up. A way to progress this exercise, we're gonna add a mat or an unbalanced mat just to get that uneven ground. They can have their weight still, and they're gonna still be doing that squat. So coming down, keeping the core tight, throwing the hips back, grabbing weight, and coming back up, squeezing the glutes. So next, with this exercise, we're doing that squat. So you're gonna make sure to tighten those core muscles. You're gonna keep your back straight, going down to that squat. So when you go down, you're gonna bend at the hips and your knees, going down, picking the weight up with both hands, coming up, squeezing the